So it all started with a decision making in your career. When I was in my class 10th, my parents were more excited than I was. They wanted me to become a doctor, maybe an engineer, maybe everything. But the question was, what I want to be. I was really young that time to understand what exactly career means. But I thought it was like, okay, you'll study, get a job, get a better job, and a better job, and that's it. So I decided, okay, fine, I'll take both. I'll take bio and I'll take maths. And I was very happy that, oh yes, I know everything. But then later, I slowly understood that it was not about the subjects. It was about something that you like to do. Maybe you like to pursue. But our society in general, say 10, 12 years back, my parents were residing in a very village next to Bangladesh. I had no exposure to what IIT means, what PMT means, or it's like, I used to study in a very small school where we didn't even had fans. So what I decided is like, okay, fine, let me study. And I was not very, very good at studies. I was like, it was a small school, so you can't just gauge how a student is. Then one fine day, it's like my dad came up to me saying that, you know what, you see people around, you have a lot many problems. And doctor is a novel profession. I mean, no matter you want to be an engineer, but trust me, doctor is a novel profession. And I was like, oh, really? Okay, fine, no problem. But in my mind, it was like, I love maths. And my passion was impatience. So my problem was, I was never patient at anything. I wanted to be like real faster, which was not at all possible. I mean, like, what you can get something which is like real fast. And to when you never know what smartphones were, forget about smartphones. You didn't exposure to even mobile phones. So I started off with and somehow got lucky to get into a medical college. I was not very interested either, but yeah, all the glamour and everything was like big books, good school, everything, the starting of the college, everything was good, the white coat especially. Trust me, the white coat was the one which pursued me to carry on with. So there came a moment when you have to prick your finger, maybe ear, to test your own blood. And trust me, I just wanted to run away. I still want to run away, like when it comes to that, you prick your own hand. So what I used to do is like a very tried and tested trick. Smile at a guy and get the drop of blood. So I used to look around who is smiling and then maybe just go approach, maybe extra drop of blood after you are done with your thing. I was very generous, like after you are done. So finally it's like, it became like I'm dragging a course which I don't want to. I was good with numbers in the sense my grades were good because, you know, at the end of the day you mug in medical college. And then I was good at it. So finally I could get good marks, impress the professors. But I didn't want to pursue it. And with days when I was like growing, I realized this is something I don't want to do. And by the end of final year, the final day of my exam, my surgery professor came up to me saying that it wasn't good enough. I'm not sure what you are going to do for the final practicals. And I was like, oh, thank you so much. I'm not going to come back again if I pass. So luckily I got good grades and I passed out of I graduated from medical college. And then it was a blank thing in my mind. I was like, no way I am going to pursue this career. But the question was, what then? Your parents were on top of your head saying that you have ruined everything. We made you doctor. Now the question is like, we made you doctor. And then you're wasting your career, no job, nothing in hand. And when I looked around, most of the medical professionals, they were struggling for higher studies. The higher studies for another 10 years, which was like against my passion. I wanted I wanted something which is ready. So it happened to be that I spoke to a friend of mine who used to be working in a strategy consulting firm. For me, the strategy word was first time in dictionary and consulting was forever up there. I was like, what is strategy consulting? So he explained to me how it works and how you change and etc. etc. And I was very interested. I went on to applying to recognized international strategy consulting firm saying that I want to work with you. And he was like, why? And I'm like, yeah, because I think you wrote in your website that you accept people from all walks of life, so why not? And he is like, okay, I would like to have your resume. And resume is another word which came to like in my life for the first time. I was like, what? And then, yes, you can forward your resume and we'll have a look. So what I did was like, I asked a friend of mine that what resume is it? Like, whatever you did in your life, you just write it in a sequential way. So I was like, oh, really? I have grades, nothing else. So what I did, I wrote my name and grades, and that's it. It merely occupied 5% of the whole page. And I sent it across very bravely. So he came back to me stating that, we wanted your resume. I was like, come on, yeah, I mean, I have sent the resume. What is he asking again? So then, I understood that. He told me that this is what we are not looking for. We want someone with experience in business or something else. I mean, only a doctor who has done, who has opened up patients has no place as such in a business world, or maybe something where we deal with changing things. I was disheartened, but I realized that, yes, he was right. I don't have adequate experience to go and change something. And that made me realize that what is the actual problem? 5 years of education taught me many things. It's like, what exactly the problem with health industry is? We have researchers, we have almost treatment to 2,000 odd number of medical and surgical procedures. But if you look around you, if you look at yourself, if you look at people staying inside your house or maybe in your family, what exactly the problem comes when it comes to getting sick? The question is like, we don't have good doctors. First of all, people crib about this. And then we don't have accessibility. What not? In fact, what not? We don't have good labs. Maybe he's not good at something, we should go to somebody else. And all these things becomes, it's like, we should not fall sick. But the main thing is that we cannot avoid it also. And then I met a boy of, say, 14 years. He suddenly got diabetes. The question is like, we all know that diabetes, which happens maybe at 40 if you take excessive sweets, which is like a general perception. And his parents were like, what did we do? We did not harm anybody that my son has got diabetes. So they were more into such sort of thing. But medicine or science, art and science of surgery and medicine is something different. It's not in your control. It's not even in Almighty's control. It is something that is happening in your body and we don't know. There might be something that would be happening to us the next day, but we don't know. So one day I sat and I thought that, let me compile what are the problems with medicine is, and then maybe we can find a solution. During that time I was writing for newspapers and magazines to make sure that everybody understand what health is, and nobody come to me stating that I have got problem in both of my liver, a statement like this. So it happened to me that, yeah, there are a lot of problems. And then I spoke to my friend who was working in a consulting firm that, what is the real problem you're working on? He said, I'm working on a problem that we don't have connectivity with hospitals across the world. I was like, why do you need that? He's like, you know what, we all study and then we plan to go to London or Paris with our wives or maybe girlfriends. And then we forget about the rest of the family. But then when problem comes, it becomes tough to connect in a span of time, like in a fraction of a second. We're trying to build that for a hospital. I was like, oh really? It's possible? He's like, yeah, it's possible. And then I came to know that there are so many softwares or so many technology that is like there today, which makes it possible for us to reach in a fraction of a second whatever we want to do. But still, it was not giving a good solution to many countries. Now the question is like, why? If we have everything, we have technology, we have like educated people, the number of people who are educated is increasing, but why the problem is same today? If you fall sick in Udaipur and you want to meet the best of the doctor, maybe say who is in Bombay or who is in America, the question is like, how would I reach him in a moment? That is not possible. You have to go through a series of tests and then doctors and hospitals, and then might be you would be able to reach him. So I wanted to make that possible in the sense like to simplify the healthcare industry. healthcare industry, which people think that it's comprised of only doctors and nurses, which is not true. It is made up of everything. It's made up of hospitals, or say technological institutes, medical devices, one which is made by people. And then it comprises of pharmacology, life sciences. You can see here, it comprises of like everything that makes us healthcare industry. Now the question is, what can we do to connect everything together? So I came across a story. I came across a story of a guy who studied in who was born and brought up in a very rural village. He went to US, and then he realized that he has cancer. So what he was doing, I wanted to understand what he was doing. So he told me a simple thing that, you know what, every day I open my mobile and I check what is happening with my body, because I have a device connected to me. And then I get the update. The update is directly going to my doctor. And then he automatically updates my prescription, which is there for the internet. So it sends me messages. It sent me timely messages to take which medicine, whatnot. And then also it updates my parents, so that they are staying, like say 3,000 kilometers apart, are free of any worry that what my child is doing there. I found it really fascinating. I wanted it to be a proper channelized thing, which makes it possible for every individual to access such sort of healthcare facility. So I designed a graph which takes you through a disease in a very simpler way. The smallest of the thing which everybody of us is having is mobile phone. I mean, I would not find a single person who is not having a mobile phone right now. So this mobile phone which connects, or say the smartphone, which connects to all of us right now with our sweetheart more than our heart at this present date. I wanted to connect it to the heart as well. So this design, I finished it from Indian Institute of Management, Calcutta, that connects a villager to a distant hospital, that connects a person residing in one house in India to a person residing in other country, that connects all the community hospitals to the main center hospital in a fraction of a second. Whatever they want to do. Now you might be thinking that how many villagers are having mobiles, let alone the smartphones. We have a solution for this. The question is, it's not about how you use a mobile phone. It's about like what it can do for you. So you can go to someone else to get it done for you. And that's what exactly we have managed, because we cannot promise that India will become US or Singapore in another 5 years. But we can definitely say that things will change. Things are changing. A person can go up to a public health center, which is like say 2-3 kilometers away from his house, to get few things done. And then a person who is like you and me, who has access to and who knows how to handle smartphone, can get many things done in one go. And this is what the system is. So a villager who doesn't know what to do can go to a PHC, which by law has educated doctors and paramedics to deal with, to help them with, and can get appointments at least. So what happens right now is they are waiting for appointments for big hospital, wasting their daily wage for days and weeks. You might not have seen them waiting like say for hours to get appointment for one particular doctor, what happens is that the traffic shifts to only one person because he is famous. You go by the line, right? If you see that so many people are waiting for one doctor, you think, oh, he's great, so I should also wait there. Thus increasing the length of the line, which doesn't solve this problem. So what we have decided to do is, we'll make a centralized appointment system which would show him which doctor is available without wasting his time and without wasting the doctor-patient ratio for the country. At the same time, when you're holding a smartphone in your hand, whatever updates you want to get, like say you want to visit a doctor, or you want to get updates about what is happening inside your body, which is very much possible nowadays with the simplest of the wearable devices. You can access everything. You can access, if you want to reduce out-of-pocket money for your medical bills, which is like a scary thing. Whenever you go for any procedure, the bill comes in lakhs. And for that, the insurance companies come to rescue. And it's a center point of entrepreneurship for the insurance companies, for the medical device companies, or say many other companies, where they would be providing services to you with a click. You can also, now healthcare is not only about technology, it's not only about like how fast you connect to a doctor. It's also about emotional support, which is very important. As soon as you fall sick, you want to go to your mother. But most of the time it's not possible because you have college and you can't just leave like that, or you say kilometers apart. But the feature of that system allows you to at least talk to her, let her see you, and let you see her through FaceTiming, which is very much possible in today's world. I'm not talking about the Apple FaceTiming, but in general, it's a feature of that system. At the same time, a person who is there in some other country, now imagine yourself working in some other country and you want to get updates of your ailing father. So this app allows you to get updates from hospital by hours. Every hour you'll be getting updates for that. So this connectivity, the graph has been developed. Now the question was that how it is possible to implement it. I mean, nowadays also, like if you see, we have many technologies which is existing. There are many companies who are providing services, but they're all broken up. You don't want to order bread from one company and the curry from somebody else, which is the condition of current healthcare system. So what I thought is that why not? The question that he said, that Bhakti said, that why not try? So I went to the government to say that, many countries are doing, they're trying, why not we? And the best thing is that they accepted the fact that yes, this can change the future of our country, and we are trying to implement it as soon as possible. It is the next generation healthcare industry which would be in billions, and you can access your health as soon as you're born with the help of just a few clicks. Thank you so much.